Welcome to Robot Unicorn, hosted by my parents, Jess and Scott. I hope you enjoyed the episode.
Hey friends, I am so excited about today's episode. It's highly requested. We're talking all about ADHD, and I have one of the best experts on ADHD with me today. Dr. Sasha Hamdani is a board-certified psychiatrist and ADHD expert. She's an author, entrepreneur, and mental health advocate. You might have seen her on Instagram, TikTok, and YouTube, where she's got like over 1 million followers at Psych Dr. MD, where she provides evidence-backed information and dispels stigma around all facets of ADHD and wellness. She's worked closely with the White House and Surgeon General team to speak out about mental health awareness and was even recognized by Harvard as a public health leader. Dr. Hamdani is the author of Self-Care for People with ADHD, and an upcoming book, Too Sensitive: Rejection, Resilience, and the Science of Feeling Deeply. I mean, as soon as I heard the title of her book, I'm like, I literally need to read this and I need to have you on the podcast. And we talked today about all things being sensitive, ADHD, what that looks like, how to get a proper diagnosis, how to understand it in ourselves, how that impacts dysregulation. It is an episode that you are probably going to want to listen to once and then listen to again and again. I think I found a friend in Dr. Sasha. She's incredible, and I cannot wait for you to listen. So without any further ado, let's get into it. All right, Dr. Sasha, welcome to Robot Unicorn. We're so excited to have you here today.
Yay, I'm so excited.
I've been looking forward to this conversation for months already, and I know you said you have too. I just feel like we have so much in common and so much to talk about, and we're going to become friends through this episode.
It's my dream. It's my dream.
Oh, mine too. Like, I want to start to say that I found you through, I think, your content on Rejection Sensitive Dysphoria, your videos on Instagram that you make about it. And I remember I was like watching it. I'm like, this is me. Like, she's describing me to a T. And I just felt so seen by your content. I know I do a lot of work with kids with ADHD and their parents, but a lot of your work focuses on adults, like so other adults who have ADHD and women specifically. And I just felt so seen by your content. And so I thought maybe we could start there.
Yeah.
Do you think you could explain to our audience what rejection sensitive dysphoria is?
Yeah. So rejection sensitive dysphoria is this incredibly robust, emotional, sometimes physical, but emotional response to rejection or criticism. And the kicker in all of this is it doesn't even have to be actual rejection or criticism. It can be rejection or criticism that you're perceiving. So basically, and neurobiologically, your body is having this huge response to something you're picking up from the external environment that you feel like, I'm at risk of rejection, I am at risk of criticism. And generally, when I talk about that, people who understand that, who have experienced that, they're like, yep, I know what that feels like. Because these are the people who tend to feel things very quickly, very deeply for a long time. And these are also the people that are being called like, you're too sensitive, just get over it, you need to toughen up. These are the people who have been experiencing that.
Yeah. I think when you label that, like when I label that to someone in my clinical work and they understand it because they feel that way, they get it right away. They're like, yeah, I totally get it. Can you give an example maybe about what a perceived rejection might be?
I can give you one that happened this morning.
Oh, great.
Me.
Yes. Let's talk about it.
So this morning, I am in this press cycle and like trying to get ready for this book to be released about rejection sensitive dysphoria. So I'm getting ready for this. So I'm on calls and texts and things with so many different people. But this one was with my agent, who I love, love, love. And so she sent me a voice note and said, hey, when you get a second, can you call me back? That's all it took. And I was like, the book has failed. Like something has happened. My brain automatically went towards, I'm in trouble. The book's in trouble. I did something that someone didn't like. And so I started just flipping out, just getting really anxious, like very, very anxious, to the point where, I was trying to get my kids' breakfast together. And usually during that time, I'm like grazing and eating all of their food that they don't eat. I couldn't eat. I was spinning. My husband came into the kitchen. I snapped at him and I was like, oh, I'm sorry. I'm just anxious about this thing. And he's like, just call her back. And I was like, okay. I call her back and she's like, oh, your Spanish cover came in. I just wanted to make sure that you liked it and made sure you got the email. And I was like, oh, okay. Okay. That's not a big deal at all. That's wonderful and so exciting. But in my brain, I was so consumed with the idea that I was going to be in trouble for something. I was going to get criticized for something. They didn't like the book. And that's immediately where my brain ran to.
Yes, that is such a perfect example. I can relate to that too, like so many times, right? Oh, hey, can you give me a call when you have a sec? And you just assume, okay, it's the worst case scenario. They don't like me. They have a problem with something I said. And it's so often that it's not even the case. So how does a brain get wired for RSD? Is there specific brains that get wired more often? Is it more of like a response to like a trauma? Like, how do we get this? How do we get here?
So a lot of times you are just born that way. And I talk a lot about this in the context of ADHD because there's no specific research about RSD because it's not part of diagnostic criteria yet. But when you look at ADHD in general, there is a huge proportion of people with ADHD who experience some component of RSD. So when you look at the data about ADHD and you look at neurobiologically how people are wired a little bit differently, there is well-documented science showing that the emotional parts of their brain, like specifically the amygdala, that threat receptor in your brain, is a little bit more hyperactive. And sometimes it's even a little bit bigger. And so you're getting this input, this external input, to a very hyper-reactive emotional center. And then the logical, thoughtful, judgment processing area of your brain, that frontal lobe directly under your forehead, which should be saying, this isn't a big deal. It could be this or this or this, and we can just kind of calm down from here. There is a delay in between the emotional part and the regulatory part. And the regulatory part structurally is weaker and smaller. So what we're dealing with is your emotional response is going to trump your logical response a lot of the time. And especially if it's something that you feel like there is a potential threat about, you just spin down these pathways. And so again, this is one of those things that for people that experience this all sounds really familiar. Like, maybe 2 hours later, I realized this wasn't that big of a deal, but my body and my brain responded like it was. And the thing that's really tricky is that sometimes when you're having that huge emotional response, you react to that. And then 2 hours go by, you realize it's not that big of a deal, but you're just cleaning up the mess of the stuff that you were trying to do to make it better in the moment.
Yeah. So many good things there that I think not only for parents to understand, let's say if they're raising a child who has RSD, because a lot of it, I work with so many parents and they're like, I don't think I did anything to my child to make them so sensitive to like my perceived rejection of me, right? Like they might have a child, and I'm curious if you were ever like this as a child, who might like lie or not want to say something to their parents, or who like runs under the table and hides after they've done something wrong. And parents will be like, I don't yell at them. I'm kind to them. I'm like doing all these things. So why is my child like so sensitive to like me potentially being upset, even though I'm not? And I feel sometimes when I can explain this to parents and be like, it's not always something that you've done. Sometimes it's just who your child is, and understanding this, it just changes things.
Yes.
You talk pretty openly about how you experience this. Do you remember experiencing this as a kid at all?
When you said run under the table, I'm like, what do you know? Because that was my move. That was my move. We had this like big, super ugly black dining table that was like this lacquered dining table. And I remember maybe once a week, my mom or my dad would say something and I would run under the table and I would like pull the tablecloth down so no one could see me. And I just did not want to come out. And one of the things that came up is one time I was with all of my cousins, and my mom looked over at me in the context of being with my group of cousins, and most of them were older than me. And she's like, you're so cute. And that was enough for me. I was like, you didn't call me cool. I wanted to be with my cousins. You made me feel different. And I couldn't vocalize any of that stuff, but I felt a deep hurt with something that as a parent, she was vocalizing her love for me. It was very positive. And in my brain, it just felt very much the opposite. And so the thing that's interesting is I do absolutely recognize being a very sensitive child. But then I kind of forgot about it. And I was like, okay, you grow and you develop and things get harder and you just kind of assume like, okay, yeah, maybe I am sensitive, but you move on. And for a big portion of my life, I was like, it's me. I'm a problem. I just feel things too much. Mm-hmm. But then I had my child and my son is so sensitive and it's like watching me again. And so it is so interesting to watch him and watch how he responds. And for me, it feels very much like this opportunity to parent him, but also parent myself. And so it really has been such a revelation being a parent with rejection sensitivity, parenting a rejection sensitive child, because it's just like, I think in a way it's made our house very gentle and sweet. Like the fact that we have to face emotions very candidly and very openly and very transparently. I think for my husband and my daughter who's sensitive but not in the same way, it's also kind of opened up for them and given them better language around emotions, better responsiveness. And I think that as a whole unit, it's helped us.
Oh, I love it. I love the full circle moment too, where you're like, wait, maybe I'm not too much or too maybe this is just part of who I am. And I feel like raising kids can really bring that up in us and be really healing in that way. If we let it be, it can also be very triggering in that way, sometimes at the same time. But I know, and I remember seeing this in one of our daughters too, who's very, very sensitive. And my husband also has ADHD. I have ADHD. There's a lot of sensitive people going on in our home. So I can relate to that. And us seeing her with these big meltdowns and stuff and being like, wow, the way we respond to this is really going to shape things. And so we really need to be so mindful of this. And also for him being like, wow, I wonder, how things might have been different for me had parents who could get curious and who could see that I wasn't trying to be bad and all of these different things. So I wonder for you, when you had, and your son was starting to become more sensitive, did it take you a minute to be like, okay, whoa, I have to be mindful of how I respond? Or were you right away oh, I see myself in this and I want to respond in a way that's really going to help him?
Can I tell you one thing that honestly happened?
Yeah.
I saw one of your videos.
Oh, wow.
I saw one of your videos, and I've seen a lot of your videos since then where it looks at behavior, but phrases it from the inside voice of the child speaking. And I'm sure you're doing this, but a lot of it also is viewed through that child's sensitivity. And so I think that was I remember seeing something like that and being like, wait. I feel like that as an adult, and it's triggering something that I felt like as a child. And it's something just kind of clicked for me there. And I started looking at my son's behavior, we're really similar. And the instance that I'm thinking about is sometimes I bring my laptop upstairs and before my workday starts, I'm just finishing up patient charts and things like that so that I can oversee and kind of help out with breakfast as my kids are getting ready. But sometimes my attention is just kind of split. I'm doing patient stuff and something complicated comes across. And also my kid is deciding what they're irate about in the morning. And so there's a lot of stuff. So I wasn't paying attention one morning and he asked me a question. I was like, what? And it was tone. I was short for sure. And he didn't say anything, but I looked at him and it was he just kind of went blank for a second. I saw him shut down and then I saw him run off and I was like, oh my God. I watched in real time as he appreciated something that he believed to be a safe space, that he had to doubt that it was a safe space for a second. He felt threatened. And then he retreated. And I was like, what? I am his parent. And yes, I'm going to be short. I will be short with them many times from here and out. But I think it's not so much about the break in that. It's about how you recover from it and how you repair those injuries. And so then I was like, I saw what happened when I used that tone of voice with you. Let me show you what I was doing. So I actually took him to my computer and I was like, let me read part of this message to you. And this is what I was so worried about. And so I was worried about that. And I wasn't fully paying attention to what you were doing. And that when you responded, it interrupted my focus, just like sometimes when I interrupt when you're doing Legos. And so that's what you were hearing. I'm not mad at you. I'm not upset with you. And then I just kind of held him and I was like, you let me know if you have any questions or if you want to talk about it more. And then he released and he was fine. But I think that was one of the first times I had done that.
Oh, I love that story so much. Thank you for sharing. And thank you for sharing that. That was helpful for you. Yeah, because like I know it, but sometimes hearing the stories, it just makes it so much more real that the words I share are helpful.
Very helpful.
Oh, thank you. And that moment where you're like, okay, I see you retreating, I see you running away, but I'm going to choose to like not get mad at you for it and like reject you because you're rejecting me type of situation and be like, I'm going to come and I'm going to show you like what I'm doing. Like exactly those are the moments. Like those are the most healing moments that are just the best. I'll give one quick example. I had a similar thing this morning, actually not with my super sensitive daughter, but with another daughter who her sisters got on the bus and she's not old enough to go on the bus yet. She goes to a different school. Her sister, oh my goodness, we'll have to deal with this when I get home, took her bracelet on the bus, took the younger sister's bracelet on the bus. And all of a sudden, the younger sister realizes she stole my bracelet, starts bawling her eyes out, trying to chase the bus. She took my bracelet on the bus.
Oh my God.
Crying, trying to chase the bus. I'm like, hun, this is not going to work. But I found myself wanting to get so upset because in my head, I'm like, I'm already late for work. I'm rushing. I got to get out the door. I can't deal with this meltdown about a bracelet that you didn't care about until 1 second before the bus and you saw your sister had it, right? And like I can feel that building up in me, and we can talk about that part of ADHD, like the emotional dysregulation, how sometimes we can get there so quick. And then I just looked at her and I was like, okay, I'm really just going to focus on like her littleness right now, like just how little she is. She has this cute little pigtail in her hair. She's like melting down over a bracelet, like how innocent. And I really just tried to use her littleness to just bring me back down. And then I just put her on my lap for a minute and I was just like, yeah, that was tough. You know, your sister took your bracelet and you didn't want her to take that to school. You don't know if it's going to get broken today. You worked really hard to make that bracelet. And then within a couple minutes, all of a sudden she's calmed down too. And then we had a nice little hug and moved on. Mm-hmm. And yeah, your story made me think of that too. Just that intention in that moment, just how much that can help our kids and ourselves too. And how that's tough sometimes as a parent with ADHD.
It's really tough as a parent with ADHD because like I hear stories like that and it's so like, it's such a good reminder and such a good example. And I always want to be that parent, but sometimes I literally am tapped out and I am already running so hot because of the day. Like, and I think that this is just segueing off of that topic about emotional dysregulation. Emotional dysregulation right now is not part of ADHD criteria, which is the dumbest thing I've ever heard of in my life. Like, I don't understand. Anybody who has ADHD, you could survey 100 people, 95 of them would say the emotional part is the worst part because quite literally with the focus, with the attention, with the executive function part, and again, emotion could be considered executive function to some degree, but if we're talking simply about the attention side of things and the getting tasks done kind of things. If you have good supports, if you have good systems, if you have built a life around I'll work so that this could potentially be easier for me and in this process burning yourself out, you can get stuff done to some degree. I mean, and you see that a lot with high achieving women specifically. I mean, they are burning the candle at both ends to get stuff done. And they will do it. But you can't do that with emotional data. You can't give that to somebody else. And if you try to postpone it and you're like, I don't have time for this right now, it is worse if you do that. Emotional processing is such a huge part of the human existence. So if at baseline you have emotional dysregulation where you feel emotions so deeply, so quickly, and then you have a hard time recovering from them, it impacts every area of functioning. And so I think that was the original motivation behind this book in the first place, because I feel like everything in psychiatry is so glacial, nothing changes. And the entire diagnosis of ADHD was built on hyper young boys. And I feel like it's just this very inaccurate snapshot of everybody else that I was hoping that with this book, us as a community raise enough attention and awareness that we can actually make some tangible changes, because it needs to be a separate part of that diagnostic criteria. Like the fact that it's not in criteria criteria. That's why people get diagnosed with anxiety or depression or just moodiness in general. Like, it's hormonal. It's just such an incomplete picture of what's happening. So including emotional dysregulation into ADHD is going to, number one, help so many people and prevent them from getting misdiagnosed. But two, from a practical and like mental health provider perspective, it is going to fundamentally change our understanding and our ability to screen and treat this condition so much better.
That's huge. Just quickly, for our audience who maybe doesn't know what you mean by emotional dysregulation, can you describe what that means?
Yeah. Well, first, in order to understand emotional dysregulation, you need to understand emotional regulation. Emotional regulation is your capacity to handle emotions, to handle the normal ups and downs that happen with emotional amplitude. Like, something happens, this is my emotional response, how do I handle it? That's emotional regulation. So if you have emotional dysregulation, it is difficulty in regulating your emotions. So emotion comes in, part of the standard spectrum of I'm not even talking about big things. I'm not even talking about a death or a breakup or a divorce. I'm talking about those small hiccups that happen in the day. Your child running behind a bus to retrieve this bracelet. Those kind of things. All of a sudden, it's not just that's annoying or something. It's like I'm dealing with this wave of anxiety that feels insurmountable, or I'm having this wave of anger and rage that feels insurmountable, or I'm having this wave of sadness for my kid. You feel things in a huge way. And I think that that's something worth talking about. I'm truly, truly baffled why people feel like we should talk about mental health conditions and separate the emotional component out of it. Like, what?
Yes.
What is that?
I have always found that to be so confusing. I remember like in my early career, I was in a meeting. I started my career in a very behaviorist field, and I was bringing up something emotion dysregulation related, and we were talking about this challenging behavior in the school, and they were like, oh, no, like we're just looking at the behavior. I was like, I don't get it. Like, wait, but we're not going to talk about the emotional dysregulation. No, like we're just looking at the behavior, and like, how can we change this behavior? And I'm like, no, like that's not going to work. Yeah.
Related. It's crazy. I can't believe that this is something that historically we just don't look at as a holistic and comprehensive manner. It doesn't make sense to treat patients that way.
Hey friends, so at pickup last week, our daughter asked Scott a truly kind of tricky question in front of her younger siblings. Scott was telling me that when he heard a question like this, he used to panic, but this time he had a plan. And he said to our daughter, "Thank you for asking. Let's talk tonight when we've got privacy." And that's a line that he learned straight from our new body safety and consent course at Nurtured First. So this new body safety and consent course is taught by me. So Jess, if you listen to this podcast, you know me. I'm a child therapist and a mom of 3, and I have taught body safety and consent education for years. This course takes all my years of experience teaching this education and gives you calm, age-appropriate language for body parts, consent, and boundaries. You'll learn how to teach your kids that no means no. You'll learn how to teach them to read facial cues. You'll talk about safe and unsafe touch, and you'll even teach them about their uh-oh feeling. There's guidance inside this course for the real life stuff, like tickling that goes too far, and even the difference between a secret and a surprise. We made this course at Nurtured First because research shows that body safety education helps kids speak up sooner, and we want that for our family, for Scott and I, but also for you. So check the course out at nurturedfirst.com/bodysafety, and to save 10%, use the code ROBOTUNICORN. And just full disclosure here, we are the creators of this course, and we're so proud of it. So earlier you talked about how ADHD diagnostic criteria was created for little boys. And I thought we should circle back to that. So can you tell me a little bit more just about how that happened and why that's the case?
So ADHD has been through so many different iterations in the DSM. It was called many different things. And in fact, the switch from the DSM-4 to the DSM-5, it went from ADD to ADHD. And I hate the name, but we can go over that in a second. But it's gone through many, many different names, many different variations. But at its base, it was originally studied, and this diagnostic umbrella was created to describe the observable behaviors of that hyperactivity, especially in males. And if you drill back down, when you're looking at ADHD as an umbrella and the differences in gender, you look at the inattentive symptoms, you look at the hyperactive symptoms, you look at the combined type. The hyperactive symptoms, the verbal and physical impulsivity, the getting out of your seat, the touching other people, the talking all the time, those are very observable behaviors because they're impacting other people. And those are typically how boys present. Meanwhile, females typically present with the inattentive symptoms. They're daydreaming, they're forgetful. The people they're impacting are themselves, but they're the ones that are getting passed from class to class because they're a pleasure to have in class. Their anxiety is kind of driving them through. And so the diagnostic criteria was based on observable characteristics because males presented primarily as hyperactive. That's how we built our diagnostic scales. And that stands today.
So tell me, and like I know this, but I want the audience to hear this too. Like, how does that impact the girls or maybe the boys too, who are the inattentive type? And how does it impact them that probably the diagnostic criteria doesn't fit them? Do they always get diagnosed later? Do they just get missed? Tell us about that.
So I think we're in a weird cultural shift right now. I think in the past maybe 5 years, truly since like the pandemic shut down, I think we all became very introspective because there was nothing else to do because we were all social distancing and on our phones. But we were talking about internal experience, and that's kind of when ADHD came to the forefront, and a lot of people started critically looking at their behaviors, their emotions, their ability to get tasks done. When prior to that, it really wasn't as huge of a part of the conversation, and even clinicians were looking for the hyperactive symptoms. They weren't looking for the inattentive girls. And so if you look, a lot of what is so unfortunate is that you look at when males are getting diagnosed, somewhere between 6 to 8. You look at where females are getting diagnosed and it's in their mid-30s. And usually it's after they've had children and they brought in their kid for assessment and they're like, wait a minute, what? And so these women are most of the time just frankly skipped. I mean, the amount of effort it takes to jump through the hoops as an adult to get this diagnosis, because let me tell you what they're going to hear. A lot of times they're going to hear, they go to the doctor, they're like, I think I have ADHD. And the first thing they hear is, no, you would have known by now if you had ADHD. You're doing too well. You can't have it. Number two, the thing they hear is, I think, you know what? This is mommy brain. You're anxious. You're depressed. You're hormonal. Let's get on top of that. And then we can re-explore ADHD. Well, the big fundamental issue with that is, what if the ADHD is causing the anxiety, the depression, that kind of stuff? The other thing they're going to hear is, we've gotten this far. Like, what are you hoping to intervene? It's too late. It's too late. Like, there's nothing else you could possibly do. And so they're meant to feel like they're drug seeking, where a lot of times these women don't want medication. I do not. Like, I've heard from patients who have come into me, I don't want medication. I don't think it's necessarily what I just need to know what's happening in my brain. I need to correct this narrative that I've told myself for years that I'm lazy, that I can't get stuff done.
So let's talk about ADHD in women and getting diagnosed later in life. I have so many questions about this, just like personally interested because I also got diagnosed later in life, but also I'm interested, do you see this in men at all, or is it mainly women, or do men who don't have the maybe like hyperactivity type of ADHD, do you see them getting diagnosed later in life? Maybe let's just start there. I'm really curious.
So more often, like if you were to look at ADHD and just the way the gender plays a role in presentation, males typically present more as that hyperactive type and females typically more of the inattentive, which makes them more likely to get skipped and ignored and late diagnosed. So yes, it is common to see in women, definitely. It can happen to men, and it can especially happen to men in cultural contexts where their families didn't believe in mental health, or if they just, there was a certain stigma against medication or starting medication, or perhaps that they just kind of manifested as more of the inattentive symptomology. Yes, absolutely could have gotten skipped, but really that's something that you very commonly see in females.
Yes. Okay. That makes sense. I asked that only because my husband was diagnosed later, and a bunch of our friends who were all men were all diagnosed in like their mid-30s. So I'm just like, is this just a us pattern that we're seeing this more? And it also could be because we did grow up in a more rural community where mental health was just like really not talked about back in those days. But it's so funny if you do look at my husband's report cards, because they ask you to like bring those in if you have them. it's all like, oh, Scott could have stood to paid attention better in class, or he could stop bugging his peers, or he could sit better at his desk. Like, so the signs were definitely there, but I think they were more dismissed, perhaps.
Or just not discussed. And especially for people our age, a lot of times behaviors were just kind of passed off as like, they're just 7-year-olds. This is just normal behavior. They're hyper. They're quirky. And so it wasn't actually picked up at that time. And now I think we're getting better at diagnostic conversations and at least clinical observations, even within the classrooms, where, yeah, it could just be some of it is not outright behavior that's going to harm the kid or impact the kid. But later, eventually, if this isn't worked on and they don't build those skills, then it can become a problem as workload increases, as life gets more real. So early intervention is really important.
Yeah. Let's talk about that early intervention, because I have a lot of questions for you, things I hear, and I'm just really curious to get your opinion on it. Because there are some cases, right, where they are really young. And parents are like, let's say, does my 3-year-old have ADHD? That's a question I'll get. And the 3-year-old is impulsive, has a difficult time sitting still. And it's like, okay, well, what part of this is just you being 3, and trying to figure out the difference. So how do you go about looking at, okay, when is the right age to bring a child, let's say, for assessment if you're curious? Or when would you encourage parents to start wondering, is this ADHD or is it not? So that we can get that early intervention and rule out that it's like just typical childhood behavior at the same time.
So what I typically tell parents is, you know your child better than any doctor or any therapist or anybody that you bring them in front of. You know them better than anyone you take them to, because you've seen their development. You know them intimately from a genetic standpoint. You know what they do from the time they wake up to the time they go to sleep. So there is a vast amount of data that a parent is going to be able to provide. So I trust if the parent has questions, is this normal? Is this not? I think as soon as you have those questions, if it's available to you, go and see. Ask somebody, ask a medical professional at that point. I don't think it's necessarily way too early or way too late to ask those questions. If you have a 3-year-old, fine. Ask it about the 3-year-old. If you have a 6-year-old, if you have a 9-year-old, like the minute you're like, I wonder if this could be the case. Because what's going to happen is you're going to go for that evaluation and they're going to look at this kiddo. They're going to ask the questions based on what they observe and what you are giving as this clinical information. And they're either going to say, this sounds pretty normal and developmental, but here are the things I want you to look out for. Or they're going to say, you know what? I think you're right. I think there is something going on with ADHD, but here are the many different roads you can go on in terms of intervention. And there's tons and tons of things that you can do and you should do before you get to that medication standpoint. And from that point, I don't think that there's any harm in talking about like how to modify your child's environment so they have better success and how to help with emotional regulation. I don't think there's any risk in having that conversation and starting that conversation. So when you start getting concerned or if you have worries, if it's available to you, I think that's the right time to talk to a doctor.
I love that. I think that's great advice. I think, and I'm curious your perspective on this as well. How do we find the right practitioner to talk to? And I don't know if this is as much of an issue in the States as I sometimes see it in Canada where, okay, we're going to talk to the doctor. But I've had parents come into my practice where I can't diagnose where I am in Canada, but I do a lot of that behavioral intervention strategies, that type of stuff. That's like, I would say 90% of the work I do with clients is parents and their child's been diagnosed with ADHD.
Wow. Okay.
But sometimes the parents come in and their child's been diagnosed with ADHD in an appointment that took them about 10 minutes, a quick little assessment, and they're already on medication and the parents know nothing about the process. And it makes me think, okay, well, this was not a thorough assessment. And maybe they have ADHD, but also I wonder how to best support parents to say, here's what you should be looking for in the person assessing your child.
So a psychiatrist, they have a unique background because you've gone through medical school. So you have an intimate knowledge of underlying medical conditions. You've gone through psychiatric residency. So you've gone through a combination of learning about therapy. You've gone through learning about the psychopharmacology of other medications you could potentially try. And then you theoretically have been practicing and you actually have patients under your belt that you've seen in anecdotal evidence. So in that, a good assessment should not only just be ruling in the ADHD, It's ruling out everything else. And ruling out everything else could also be, is this normal behavior or not? And so that takes time. You can't do that in 10 minutes. You have to actually kind of understand, ask those questions, get history. A lot of times too, you're assessing someone and you're like, I don't have enough information for this. This isn't something that I can make even in the first visit because I don't want to give you a diagnosis that's going to follow you around if this isn't accurate. I want to get more data. So here are the additional pieces of information. And that might be like, can you give me like a test that your teacher takes of what they've seen? Or maybe let's talk with another care provider or something like that. So it requires a lot, a 10-minute assessment or just something. I get this question a lot. Like, I did an online assessment. Does that count? Is that going to give you the best diagnosis? No, 100% no, because it will not be able to rule out other things. So the specificity that you need to get a good, accurate diagnosis, there's a lot more that goes into it than just ruling in ADHD. Now, in terms of who can diagnose, again, I'm having this conversation knowing that access isn't available for a lot of people for a lot of different reasons and a lot of different ways. It might not be that you don't have options. It might be that for whatever reason, insurance won't cover one of them, or for whatever reason, you're afraid to go to one of them. So what I would say is I will tell you my biased opinion. If it is accessible to you, I prefer people to start with a psychiatrist. And again, that's probably biased because I am a psychiatrist, but I like it because I know they have that underlying medical history knowledge. So I think that's really, really important because there's a lot of medical conditions that can look like ADHD. I know that they've had that psychiatry training. So they have at least an understanding of the psychology behind what other factors could be impacting this, which I think is important, very, very important, and what medications potentially could be helpful. And along that road, if you're getting assessed, you'll be in one spot. And then at that point, if it's like, yes, I think this is more appropriate for behavioral intervention, great. You've gotten a good clinical diagnosis and you can point them in the right direction, or you could do the therapy yourself. Or if it's like, okay, now you have the diagnosis, I really think you would benefit from medication, then you're already in that same place where you can get that medication and you're with an expert who can provide that for you. In terms of who else can give that diagnosis, if going to a psychiatrist isn't available to you, primary care doctors can give that diagnosis and they can also prescribe. Neurologists can give that diagnosis and prescribe. Pediatricians can give that diagnosis and prescribe. If you wanted to get the diagnosis and not necessarily, if it's literally, I need that first step and I need a diagnosis, you can go to a therapist. You can go to a mental health provider, and there's different rungs, obviously, like you can go to a PhD, you can go to a licensed clinical social worker, you can go to a form of a psychotherapist to get that. With each of those, I often tell people there is differences in how each practitioner provides that service too. So I think it's just really important that there's also something to be said about the style, like working and having this collaborative conversation about diagnosis with you or with your child. You have to like the person. So I think a lot of it also depends on, like, do you like that person? So it could be that they're perfectly well educated and that person is just, your child can't open up to them. So the right choice isn't just based on like what information they can give you in their clinical background. It also has to be like what's providing that safe spot for your child.
Yeah, I think that this is great. It's good to understand for parents where they can go and who they can talk to get this diagnosis. But also, I love that you explained what an accurate diagnostic process should look like, because I think it can be quick and easy sometimes to, let's say here in Canada, if you go to your primary care provider, your family doctor, and that's where I often see they get the diagnosis really quick. They start the medications really quick, but the parents don't have an understanding of what's happening, or maybe there is more going on and something's getting missed. It's not to knock the primary care physicians who are doing so many things for these families, but sometimes I think that can be a little bit difficult down the road when we're trying to understand why these behaviors are happening or why the kid is struggling as much as they are.
And also it becomes a little bit difficult because medications can be so incredibly life-changing for so many, but medications are medications. They carry risk as well. And so if things aren't well thought out, like for example, sometimes I have people that are completely 100% convinced that they have ADHD. Their algorithm has sold it to them. They're like, this is what's happening. I know it's what it is. But then we get into it and we start talking and we actually dig apart symptomology. And I'm like, I agree with you 100% that there's something fragmenting your focus, but I think this is anxiety. And then we go through and I'm like, well, what about this and this and that? And by the end of it, we're both kind of on the same page. Like, I think it's the anxiety driving that focus fragmentation rather than ADHD. So let's start from a more logical place. Now, if you didn't take that time and really dig into that, then you might get into that and you might throw a stimulant at this patient who is anxious. You give a stimulant to an anxious person at baseline if they don't have ADHD, and it's like adding gasoline to a fire sometimes. And their anxiety just revs up and everything gets acutely worse and focus gets worse. So depending on the situation, and there are some people where their ADHD causes anxiety, so it really does take quite a bit of finesse. I will tell you, ADHD diagnoses, I love doing those evaluations because I think it's because I have it and I understand how it feels to be both the patient and then also the prescribing doctor. I really, really can relate to what people are saying and I understand that, but it's never an easy diagnosis, ever. I have never had someone where I'm like, yup, that's for sure what it is. Absolutely. No, because I want to make sure that it's correct and I want to make sure that we haven't missed something that it could look like. So you really have to go in depth.
Oh, I think that's so good. Can you just be everyone's psychiatrist? You've got the time, yes. Right? Okay, you've talked about medication. I think we should talk about medication. Talk to me a little bit. We'll go back to being a parent with ADHD. So let's say you've just been diagnosed with ADHD, you're a parent, or maybe your child's getting diagnosed. A lot of people are afraid of medication. They're really scared of it. What is your view of medication as a provider?
I think it's okay to be scared of medication. I think that's actually a pretty healthy standpoint. Because like at the end of the day, and I get it, like I'm a psychiatrist and my whole job apparently is to throw pills in people's faces. Like that's what people think psychiatrists do. But I think I'm pretty medication averse because if you don't have to be on medication, I don't want you to be on medication. If you have to be on medication, I want you to be on the least amount of medication for the least amount of time possible, because I feel like with truly taking care of your brain, there are also many other factors that go into it. There is a huge behavioral component. There's a huge lifestyle component. There's a huge thing where if you drill down and you can utilize medications to help you get onto a pathway where you are also doing things like building a life around these kind of organizational structures and eating well and hydrating and exercising, that in conjunction with the medication could be an incredible intervention. And some people are able to get off the medication. Some people, on the other hand, don't. They need to be on the medication, and that is totally fine too. What I want at the end of the day is whatever you're on should be helping with causing the least amount of harm, and it should be the least amount possible. Just because as we get older, our bodies just work less well, and we're more likely to be on other medications for stuff. So I want to be on a low amount of medication going forward. And that's not a moral judgment against medication. I have at many times in my life needed medication. There's no two ways about it. And there are times where I've been off of medication. And if I need it again, I would pop back on medication. So I don't feel strongly one way or the other. It's just what your body needs or doesn't need. So I think it's okay to enter it from a spot of being nervous because I think that's really normal. But I think what a good practitioner should do is let the patient guide the interview in terms of like, number one, being able to ask questions. Number two, explaining clearly to the patient, these are our options. And let me explain, when we're thinking about ADHD medications, we have these behavioral options. And if for some reason you want to think about medications, or if we need to think about medications, here are our medication options. These are the classes it falls into. These are what's better for like maybe anxiety and ADHD. And then clearly explaining risks, benefits, and then what it looks like if you wanted to get off of the medication in the future. Because there's some that are really easy to get off of, and there's some that are a little bit harder to get off of. So it just kind of, this conversation, what I really enjoy about psychiatry is it's incredibly collaborative. Like there's no way I'm going to understand your internal environment better than you do. But my job is to give education and guidance based on what you're telling me so we can work together and create a plan together that's going to work for you. And so I really enjoy that part. So I think the thing that helps with that level of unease with medication is truly education about what your options are.
Yes, I think that's so great. And you talk too about like, there's different things, right? So there's sometimes that behavioral strategies, or just even I find a lot of people understanding how their ADHD brain works and being like, oh, so like back to the beginning of our conversation, that's rejection sensitive dysphoria. Okay, so that's what's happening. So now I can create some new thought process when I start feeling rejection so that I don't go spiral down this hole every time. To me, that's been very helpful. And then, but like I'll speak from my journey was being diagnosed with anxiety all my adulthood life.
Yeah.
Which I'm sure is probably common for women. And being a therapist and being like, okay, well, listen, I've been to therapy. I've tried every tool for anxiety that's out there. I have a healthy lifestyle. I eat well. I exercise. And I remember I went to my doctor and was like, listen, I do everything I should be doing. I have all the tools for anxiety, yet I am still struggling so much. Like there's got to be more going on. And that's when I ended up going down the path of getting assessed for ADHD and that making so much sense for me. But I actually wasn't intentionally like seeking an ADHD diagnosis. I was seeking help for my anxiety and stumbled across an ADHD diagnosis.
Yeah.
And I wonder how common that is, but that was my journey at least.
It's really common, especially in women. I feel like it's so common because like women, I feel like they have these ADHD symptoms that are manifested, but it's the inattentive stuff. So they get passed from class to class. And then the first break that really happens where things become obvious is during puberty. You get this, like these changing hormones. You're weird anyway. Like things are happening. And when that happens, that is this unique diagnostic window. Like, okay, well, now you have this hormonal chaos. You're less able to kind of attend to what's happening. And now balls are dropping. Things are hard for you. But especially historically, what has happened that during that time, these girls are just like, it's hormones. You're just going to be like this. It's no big deal. And so they get skipped in terms of diagnostic stuff. And then what happens is they just learn like, okay, well, I'm not like, this is just how I feel. I guess if this is what happens, I'm just going to feel like this. And they kind of skate by until their needs kind of change. Like maybe college load gets harder, or graduate school gets harder, or they get into a relationship, or they have kids, like some other thing shifts, and then life becomes really hard, and not just from like the focus and attention perspective, but from the emotional side of things. And then they're running to their doctors like, something is wrong. I'm so overwhelmed. I'm so anxious. I can't sleep. I can't do. And providers just zoom in on this woman is anxious, so she has anxiety. Not the step underneath that, like, what is causing this anxiety? What is this overwhelm? What is this executive function breakdown? And so a lot of these women go through multiple rounds of anxiety medications, maybe multiple rounds of when the anxiety doesn't dissipate and they start showing depressive symptoms. Now they're being treated for depression as well. And then by the end of it, you get into a spot where it's like, okay, I've given years of my life, just like what you were just, I've used all my tools. I can teach my tools, and this isn't helping me. And that's kind of when they get into this tipping point with, I need something isn't working. Let's try a different direction. And then it's really kind of a crapshoot whether your doctor is going to be like, yes, you're right. Let's go down this direction. Let's at least check it out. Or whether your doctor is going to be like, that's anxiety. Let's try another medication because we can't diagnose you with the ADHD until your anxiety clears. And you're like, what?
Yes.
So it's frustrating.
Well, exactly. And I felt I had the privilege of coming in as a therapist myself and being like, look, I know that there must be something more going on because I know what I'm doing should be helping. Like just looking at it from a helicopter view, there's no reason I should be this anxious. But a lot of people don't have the language or the confidence to come in and be like, this is the situation, right? So then they get misdiagnosed for so long.
Or they've tried to use their language and they've been shut down repeatedly. And that's something I've heard. Usually by the time someone is coming to me, they've seen 3 doctors already. I'm not like the first place they go most of the time. Usually they've tried many different roads and they're coming to me. And this is the first time they've actually been able to open up about what's going on, because most of the time they start having this conversation and it's a 10-minute conversation. They're diagnosed with anxiety again, and they're sent on their way.
Well, then that makes you second guess yourself. You keep getting diagnosed with anxiety. You're like, I guess I'm just anxious about
Yeah,
this,
I was wrong.
Right? It spirals. So on that note, and talking about medication, and I think you've alluded to this, but I want to talk about this too. Do you think it's possible to treat ADHD without medication?
100% yes. And I think it's very personalized based on the child or the adult, whoever is going through this. I think it is extremely, extremely dependent on the presentation, on the support, on the work you're willing to put in. There are many different factors. It also really depends on just like your genetic and medical constitution, right? Like if there's a lot of other things going on, sometimes it's hard to apply those behavioral skills or work on those lifestyle modifications because your life is literally on fire. Like you can't even maintain those habits, or you can't even remember to use those therapeutic skills because it's so chaotic up there. So I think it is very possible. And I think that that's why it's usually such a beautiful starting point, because I think you need behavioral skills before you try a medication. I think you should at least be trying that. And if for some reason you can't do that, then yes, medication is appropriate. And then you go back. But the data has clearly shown that the combination of both medication and behavioral techniques leads to the best symptom relief.
Yeah, so both working together, and often sometimes we need the medication at first, to kind of calm things so we can try the techniques. But I think that's really encouraging for people to hear as well, right? Especially people who are very averse to like being on a medication, that the behavioral techniques can be helpful, or people who are on medication to be like, it's okay. Like sometimes we do need that as well.
And what I will tell you is there's a lot of people when they think about medication, they think about Adderall, Ritalin, Vyvanse. There's an entire class of medications that are not stimulants that treat ADHD. So there's an entire world of these. For people, a lot of times they're just really hesitant and they've been taught or heard this kind of overwhelming dialogue about pill seeking, drug seeking with these medications. And it becomes such a disruptive undercurrent because I think the people who are trying to be treated for ADHD, a lot of times they're not remembering to even pick up their medications. Like these aren't the people I'm super concerned about. So I think it's just an unfortunate state that we live in terms of we haven't quite figured this out. But I feel a huge proportion of people that actually would be better served with a long-acting non-stimulant instead of like a short-acting stimulant. Like even the long-acting ones are short. They're not all day. Because these long-acting non-stimulants, they give you 24-hour coverage, most of them. And I think that the consistency of that really helps ADHD people. Like knowing that like, I don't need to worry about this as much. If I feel this, that's where people tend to feel like, okay, I can build the rest of my life on this because I feel like I've hit even ground. It feels like evening the playing field.
Yeah, that's really fascinating. Because I agree. I feel like most of what you hear about is the stimulants that people are on. And for many people, they are life-changing and super helpful. But it's great to know that there's another option as well that might feel a little more even for folks who struggle. I think that's great. And I think there should be more conversation, education around that. Because from at least my experience, I don't think a lot of parents know the range of options for themselves or for their kids as well.
Yeah, it's just not talked about.
No. We've talked about some behavioral strategies. Are there any like one or two or three like that you're like, I love these and I want every ADHD person to like try these strategies out?
Some things that I have really enjoyed recently is sleep has never really been a good friend to me. Like I just have a really weird relationship with sleep because sleep is boring to me. Like I don't love it. And I feel like that little period when I'm supposed to be sleeping, that's when my brain is most active and I have great ideas. And that's when I want to do all my projects. And so I felt like for a huge portion of my life during that time, I would be anxious about forgetting something. Like I'd get a good idea and I'd be like, oh my God, okay, let me just think about every single permutation so I'm absolutely sure I'm not going to forget. And then obviously in the morning I forget. So I have a notepad by my bed, not like my phone because I felt like I was getting distracted by the light, but a notepad. And I will just write stuff down as it's coming out. And it like gives me that like relief, like, okay, it's written down. I don't need to stress about this. And that's one thing that's been hugely helpful for me.
Yeah, I love that. I use my notes on my phone, but it is like a disaster in there. Like, so help me if something ever happened to me and someone was like, let's read through Jess's notes on her phone. But yeah, I put all my ideas in there too. And I found that that's also been very helpful because otherwise the blessing of an ADHD brain is that it can be highly creative, but sometimes you get the ideas not at a time where you can actually do something about them. So having a place to write that down, I think is great. Is there any other like tools that have helped you just on a day-to-day basis?
I think some of what I feel has been really helpful for me. Also something I don't like. I don't like exercise. And I know I should. I constantly try to rework my relationship with exercise. But at the end of the day, like, I have so much hair. I don't want to get sweaty. Like, I don't want to, like, it's a whole thing to wash my hair. I've never had that release of endorphins after exercising. But I think what really changed my relationship with exercise is when I understood that I'm not doing it necessarily to look hotter, because I'm like, why isn't this not working immediately? Is because it is a completely free way to improve my circulation, blood flow, and thought. Like, it helps me think clearer and more organized and more regulated. And so I think that once I kind of understood that I was working out for my brain and not necessarily just for aesthetics, it really changed my relationship with exercise. And now I try as hard as I can to at least get in some form of, and my exercise is weird. Like, I don't have a regimen. I will only go to the gym if I know my husband's there so that I can like fool around and, you know, just like distract him on the machines. But like, I don't ever have like a set thing. Like, if I want to do arms, I'll do, it's whatever machine looks interesting at the moment. Or I'll do like a dance cardio workout on YouTube, or I'll do like, it's just kind of whatever sustains me at that time. And I keep it different. And like yesterday I walked to the park with my kids and that was my exercise. So it's just some form I think has been helpful.
Yeah, that's great. I could so relate to that. I've always hated exercising too. I don't like being sweaty. Like, who wants to be sweaty?
I mean, some people do.
Some people do, but I can't relate. But what's helped me, and I will say a strategy that's helped me a lot with ADHD is like recognizing that sometimes I need someone else to be there, like also doing the same thing in order to do the thing. And so for me, I'm like, I can only do like a group class, and I have to like have that sense of like, I signed up for it and I paid, I'm going to go. Like, I will force myself to go. And I do feel better. And it's so funny because for years, whenever I'd get really stressed out, I'd always say to my husband, like, I need pressure. Like, can you just like push down on my shoulders or like give me some pressure? And I find that the like doing some strength training workouts like really helps me just like get that regulation through like the pressure. So that's been really helpful for me.
It's a good way to think about it. Like, it just is immediately regulating, which is not, I wish it didn't work as well as it does.
I know. Same. Because now if I go without it, like, I haven't been to the gym in a week and I'm like, yeah, okay, I know I need to go back because like I can just feel that my body's craving that now.
I know. And like, I don't sleep as well. And like, I'm stiff and I'm just like, why? I didn't have this in my 20s. Why am I having this now? So
yes,
yeah,
I know.
It's really unfair.
Those are great strategies though. And I'm sure we could always, come back and have more strategies for parents and for their kids as well. But by the way, sorry, I should just like clarify this for the beginning. If you associate with rejection sensitive dysphoria, is it automatic that you have ADHD, or is it possible to experience this outside of ADHD? We should just clarify that.
You can absolutely experience RSD outside of ADHD. For sure, you can. I feel like the reason it is so closely linked with ADHD is just because that's kind of how William Dodson is the psychiatrist who coined the term, and he has done extensive research in ADHD. And so it was studied initially within that patient population. And because it's so common in ADHD, that's why we typically link those two together. But you can get it with trauma, you can get it with anxiety, you can get it for so many different reasons. It is a neurological phenomenon.
I love that you talk about that too, like the neurological phenomenon, like the impact of like the genetic component to ADHD as well. Like, I think that that's important to understand, and I wish more people could understand that as well. Okay, so my question is then, if there's one thing that you wish a sensitive or people with ADHD could really like take in from our conversation and kind of hold on to, is there one kind of takeaway that you hope that they'll have?
I have two takeaways. My first takeaway is that I hope that for anybody who's listening, that they feel heard. And that for me, even writing the book about rejection sensitive dysphoria was so healing for me, just because like gathering all that data, it really did make me feel quite seen. Because I think when you're experiencing that in a vacuum, and especially if you're being told by multiple loved ones and the people around you that you are too fragile, you're too sensitive, having that way of reframing it and actually harnessing that and utilizing it as a form of emotional intelligence is so important. And so I think that just being able to understand understand, like, this is real, this is neurological. There are tools that you can use that absolutely help it. And there are medications that you can use if those tools are not as effective. I think with that understanding, it's so liberating. And or at least it was very liberating for me, because I really related to that concept. And especially as I studied it more, it made more sense to me. And the second takeaway, I think, is probably just more ADHD specific about the way people look and view this diagnostic process. It is complicated, and it's something that can't be adequately done in just like in and out, like paper visit or online visit because you really do have to rule out other things. And so the reason why getting an accurate diagnosis is so important is because you really do need to understand where that focus fragmentation is coming from. Otherwise, it doesn't get better.
Mm-hmm. I love that. Both of those takeaways, I think they're so important. And I just want every parent who's wondering about themselves or their kid to listen to this episode. So thank you so, so much. Let's end by telling us, like, we've talked about your book a little bit throughout. I know it's going to be amazing. I can't wait to read it. But tell us a little bit about the book and what we can look forward to from you.
Yeah. So the book is called Too Sensitive. It's being released on August 25th. It's an interesting book in that it's broken up. The first part is quite literally explaining, when I keep saying it's neurological, it's explaining what's happening in the brain. So I think that's a really important, how I educate my patients in clinic is that I start with that understanding of like, look, this isn't just you. This isn't something that you made up. This is how your brain is wired differently. So that's what the first part of the book goes into. And then there's a sensitivity spectrum assessment. So it tells you, like, when people ask, like, how sensitive are you? Are you too sensitive? Are you not sensitive enough? This kind of shows that there is a huge spectrum of emotional sensitivity. And there are people where it doesn't impact their lives tremendously. And there are other people that emotional sensitivity is a huge part of their lives. So finding out where you fall on that spectrum, and then the final parts of the book are the tools that you actually use once you figure out where you are on the spectrum. And then the last part is actual real world examples of how to apply it. So there was a shift in tone with my partner. What do I do? Well, how do I apply it in this situation? Or things like I got passed up for a promotion at work. What do I do? Or I had a conflict where within like a close family relationship where I didn't know how to communicate with a loved one because I felt like I was being judged or I felt guilty about something. So all of those are like, here's the tool you use. Here's what's happening in your brain. Here's how you apply it. Here's some practice that you could do. So I think that at the end of the day, my hope is that it is a book that reframes emotional sensitivity in a way that feels very usable to people.
Oh, it just sounds so good. And I know our listeners are going to love it because every episode we do on like ADHD sensitivity, we have the most listeners. Like people just are craving this information and specifically, I think for themselves too. So I just know that it's going to be so great and I can't wait to read it. And I have goosebumps just like thinking about reframing sensitivity for ourselves, for our kids, so that it's not this terrible thing. We're not too sensitive. I don't want my daughters thinking that this is a bad thing, that they're sensitive, you know? So I just really respect and love the work you're doing. So thank you so much for sharing with us.
Thank you. Thanks. So, and like, just to put a bow on that, because I think it was so beautifully said, especially with your daughters, I love my emotional sensitivity. It's made me a better person and a better parent and a better doctor. I mean, I think that there's so much about that emotional sensitivity that is so powerful, and I wouldn't trade it for the world. This book is not about becoming less sensitive. It's about becoming more in control.
Yes, yes, yes. I love it. One of my daughters was having a moment the other day, and she was so emotional about something. And why do I have to be so? She was crying, and my husband's like, "You know who you're like? You're like mom." And then he was like, and that's a great thing. That's why mommy is so good at being a therapist and working with people, because she like feels things and it's such a good thing. And he was like trying to reframe it to her. And then she was actually like, oh, okay. Like mommy's like this too. Like, and it was just such a beautiful moment of like, it's not a bad thing. It is about how can we control it and not let it overtake us. And so I just love it so much. Thank you.
Yeah.
Thank you so much for coming on.
I loved it.
Hey friends, thank you so much for listening to today's episode. We are glad that you are here. If you enjoyed today's episode and found it interesting, we'd really appreciate it if you'd leave a rating and a review. Scott and I actually sit down together and read them all. A 5-star rating helps us share our podcast and get these important messages out there. Thank you so much for listening, and we can't wait to talk to you again next time.